by just, let me just get this. Okay. So I just want to start by just really briefly telling you what happened in my family. So when I was a very young teenager, one of my grandmothers had a stroke and consequently had dementia. My grandfather took care of her for 3 years, and he became very ill because of taking care of her. So he couldn't do it anymore. They moved in with us, and we continued to take care of her for the next 7 years. So this is when home care agencies were not even around anymore. And that's just what you did when people got older and got sick, was the family took care of you. So we took care of her for 10 years in all. My other grandmother didn't need care until she was 90. She did not have a lot of money, and she did not want to move in with any of her kids' families. She was staunchly independent, and she didn't want to even take financial assistance from them. So my parents found a very nice facility, though, for her, and state aid provided or paid for all of her care in the facility, and she needed care for 6 years. So by the time my mother was 60, she decided she wanted to plan for her own long-term care. And she wanted something very different for herself. She wanted to be in total control of whatever could happen. And she had 3 objectives. She wanted to be at home. She wanted to stay at home and die at home. She didn't want to burden us kids because we'd already taken care of my grandmother for 7 years. And she wanted to preserve the money for my dad in case she needed care before him and died before him. And that's actually what happened. So because she didn't want to rely on us kids or her own funds, she had to buy long-term care insurance to create that funding for her care. 15 years later, she needed long-term care. She didn't have dementia, but she had physical issues. And no one in a million years would have thought she would need care, especially that early, because she was very strong and fit and engaged in life. But she started needing care several hours a day for several days a week. And then as time progressed, she needed more assistance. By the time she passed away in 2016, her policy paid $9,000 a month for her caregivers. And so they didn't have to pay $1 for her care. They didn't, out of their own money. So they didn't need round the clock care because dad was there and he could take care of the night shift, for example. But my mother planned so well that it worked out exactly the way she wanted it to. And we, as a family, very grateful for how it turned out. And it was a very positive experience in that case. So when we talk about long-term care, you may wonder, like, what is it really? So to put it in perspective, I'll compare it with medical care and hospice care. So with medical care, when you need medical care, you go to the doctor, the hospital, or rehab, and the objective is to make you better or manage your symptoms. If you have a terminal illness, you need hospice care, the objective is to make you more comfortable. So long-term care is different in that it is when you have a chronic problem, chronic illness, and the objective is to help you with your activities throughout the day. Whether you physically need help with your activities or because you have a cognitive problem and it's not safe and you need somebody to be around to supervise you. So let's talk about the activities. So activities of daily living, sometimes we call those ADLs, and you may have heard of that. There's 6 main activities. If you need help with at least 2 of those, then your doctor may say you need long-term care. And when you need long-term care, when you need help with these activities, you also need help getting to the doctor, housekeeping, preparing meals sometimes, or shopping. And that is what creates the expense for long-term care, is the number of hours that you need this kind of assistance with. So let me give an example for my mother. When she initially needed long-term care, she needed help bathing and dressing. Later on, she needed also help with toileting and transferring. But initially, when she was showering, she was She could shower by herself, but she wasn't steady. So she needed somebody to be nearby to make sure she doesn't fall. And that's called standby assistance. So that would be one activity of daily living that she needed help with. The other one was dressing. She could not put on her garments, all of them anyway. So she needed someone to help her with that. And that's called hands-on assistance. So either you might need hands-on assistance or just standby assistance with this kind of care. If you have a cognitive problem, we usually think of dementia, Alzheimer's. That could be other types of issues, disorientation or reasoning. And it's when you need somebody to be nearby or be by you to supervise you or to cue you. You might know how to, you might be able to physically dress yourself, but you forget to put on your coat when it's cold. So you need somebody to be around to make sure that you are safe and other people are safe in case, let's say, you don't turn off the stove. People need care at home, and most people do want to receive care at home, but there's also wonderful assisted living facilities out there, memory care facilities, nursing home, and adult daycare centers. We have a 70% chance of needing this kind of care from age 65 on. So from 65 on, we have 70% chance. And as someone said to me, that is too high of a percentage to ignore. It's really, really important to create a strategy for yourself. Not necessarily has to include insurance, but you must have a strategy or like a game plan of what do you want to have happen? What is most important to you? Who is going to be the person to make decisions for you if you can't? Where do you want to receive care? And then, of course, how are you going to pay for it? And so the first, let's go through these, items that I would recommend that you think about for yourself and also talk about with your family. And I can't emphasize this enough, that this is probably the most important thing that you need to do for yourself. So the first thing is to come up with your objectives. What's important? What's the most important thing to you? And I know, Paula, you had some experience with some of your clients.
Yeah. Can you folks hear me? I know I'm off screen, but
yeah,
you can hear me. Okay, great.
Oh, I can see you too.
Okay. So we have 100 plus people on, and I know that means we have 100 plus individual stories in different, what I call combination platters of concerns. Mm-hmm. So during COVID, the calls I received involved this. The very first call was a man, 92, who said, what should I do? Literally, he said this, what should I do if I die at home? And then I asked him what he meant by that. And he said, well, my wife has dementia and my family doesn't live here. We have no care. I've been able to do this all along. And he was 92 and COVID had started. So this is why you will hear me repeat all the time, proactive planning. So I believe we have younger people on today, and I'm going to ask them really to start posting questions about long-term care insurance and how it might help you, and if you're thinking about it for yourself. Because when it first started, long-term care first started, some people thought it wasn't going to last, that they would pay into it, and then somehow it would disappear. And there was a lot of, I would almost say, urban myths about long-term care insurance and whether or not it was helpful. But my experience has been for my clients who have it and do need home care, assisted memory care, board-in care, or adult day health care, it has been a miracle for them because it has really helped people cut costs. Not only does it help you cut costs, it helps you invest in yourself and your future. It helps you not be a burden to family. And a lot of older adults, and as we age and have young people and they're going to school and they're looking at jobs, a lot of parents would tell you they really don't want to be a burden to their children. So there's a lot of reasons why people evaluate long-term care insurance. And so there's a question from Terry about, does Avenidas offer local services and locations that offer care and their prices? So a lot of people do call me for what's called elder care consults, and I will talk to you for an hour. If you're a caregiver, you might join my caregiver group. Yes, and I'll go over the local resources and the costs. And actually, we do have a slide, Terry, about costs of care in this area. So thank you for asking that question. Okay.
So I think the key, these points are things definitely to think about for yourself. Your objectives, like my mother had her 3 objectives. And if you can't think of your objectives, think about what you're most concerned about. What worries you the most if you need long-term care? And then your strategy is you want to set that up so that you can take that worry away. But you also want to know who your point person is going to be. If you can't make decisions for yourself or write checks for yourself, who is going to be able to step in and know what is important to you and make those decisions for you? It's so important to have your power of attorneys, your trust set up, you know, all of these documentations, your do not resuscitate form, everything current and set up the way you want it to be. And when we don't have this documentation, it makes everything so difficult and complicated too. You want to also really think about where you want to receive care. Most people do want to receive care at home. And then some are just staunchly, they just want to stay home. But other people are very open to, if it's not possible to stay home, to go to assisted living or facility. So it's very important to think about what's important to you and talk with your family about that.
Denise, we've got some more questions coming in.
Oh, sure.
It may jumpstart.
Oh, that's good.
It may jump us ahead in your presentation.
Okay.
But let's just see where we go. So one is asking about Avenue Services, and I posted my contact information. So folks can call me if you're looking for an elder care consult and looking to discuss not just long-term care, but the big picture about proactive planning for yourself or a loved one. So here's a question. My employer does not offer a long-term care plan. How do you find and choose a long-term care plan?
What was the first part?
How do you, the employer does not offer long-term care.
Oh, it doesn't.
So how do you find and choose a long-term care plan?
You want to have a discussion with an agent who works with several companies, and the discussion would be about, you know, what your objective is of the policy. Talk about your financial situation. What amount of premium is, affordable for you? How much coverage is ideal for you? We have to strike a balance between the amount of coverage and the premium, of course, for each individual situation. So it's more of an evaluation, conversation with the agent, and evaluation of companies out there. Some companies are more competitive than the other with certain ages. So it's a matter of comparing and discussing, you know, your situation with the agent.
I know we have a resource slide at the end. Were those links at the end a way to find the agents and the insurance companies by when you click on our resource links at the last slide? Oh,
the resource links that we have are just for the Department of Insurance. So no, Department of Insurance and the California Task Force. But I think,
so if somebody says, Denise, I'm going to call you, I'll consult with you, but if I want to find other people, how would we find other insurance brokers who do what you do?
So there's an American Association of Long-Term Care. I think that's what it's called. If you Google it, and they have a list of agents that specialize and focus on long-term care insurance. In California, I think it's California, but they might also have for other states as well.
Okay, let me just see some of these other questions. Oh, they're coming in, Denise. We've got 7 minutes.
Okay, that's fine. That's fine. We can go through slides as your questions come up.
Okay. So people are asking about the best age to really apply for long-term care insurance and the costs are prohibitive as somebody gets older. And if you start to develop an illness, do you not have eligibility? Do you not meet eligibility? Okay, so let's just start with age and eligibility.
Yeah, so ideally, to me, the ideal age is early 50s. And the reason I say that is because usually people are still healthy at that point, or they don't have health issues. I see health issues starting in the late 50s and 60s. And they're also at a point where they're getting more serious about retirement planning. And they're seeing their parents get older and maybe turn a corner in their health. And so they're seeing that, writing on the wall about their parents needing long-term care too, potentially. And so it's becoming more, they're becoming more aware of it. So that all of those things coming together, the early 50s seems to be, and the prices, of course, are a lot less then. So that's what I would say would be the ideal age. But I definitely have people who buy policies in their 30s and 40s and 60s and 70s.
Okay. So Denise, I'm going to change our game plan because there are so many questions pouring in. So
Okay.
everybody, I'm going to ask for your patience. Let's have Denise go through her slideshow, because I think she's going to answer some of your questions, and then we'll go back and we'll stay on as long as necessary to answer all of your questions. Okay.
Wow.
So
Okay.
I think that's what we're going to have to do.
Okay. Yeah. So we'll try to be brief so we can get to the questions too.
Right.
But I just want to make a point about the strategy too, is when you think about paying for your care, handling your care, you look at your resources, which would be potentially family, your own money, Medi-Cal might be important for some people to use and access, and long-term care insurance. And the question would be, how much weight do you want to put on these resources that you might have to create this plan for yourself? So let's just talk about long-term care insurance a little bit. As you said, the early policies were not very good. They were just nursing home policies. Then they added home care in the 70s and 80s. You had to go through so many hurdles. Like you were saying, Paula, it just hardly anybody received benefits from those policies. Then the 90s, we started getting more legislation, regulation. And when HIPAA was passed in 1996, that created some standards in the insurance policies. So, and one of the things HIPAA did was define what long-term care was. And they defined it as when you need help with at least 2 of that list of 6 activities of daily living, or you have a cognitive problem, then you qualify for your benefits. There are 2 types of policies. One's a traditional policy. And a traditional policy is you pay your premium. Then if you need care, then you start receiving your benefits and don't pay a premium anymore. But if you just pass away, then nothing comes back to your estate or beneficiary. So there's no cash value or death benefit in these policies. And it's similar to, let's say you pay your premium for health insurance or your medical insurance and you don't use it that month, you don't get your premium back. Or car insurance, if you don't have a car accident, you don't get your premium back. So it's that type of policy, it's just pure insurance. The other policy with linked benefits, so they're linking 2 types of benefits together. The significant benefit is long-term care, but it would give you money back if you just pass away or don't use a lot of the benefits for long-term care. So those are the main differences between the 2. And the traditional policy with the premiums are not guaranteed. So we could have rate increases, and we have had rate increases on some of the older policies. With the linked benefit policies, the premiums are guaranteed, so they're not going to change over time. And they cover, by the way, pretty much all the services people need. They cover home care, assisted living, nursing home care, memory facilities, and adult daycare center. The premiums are going to be dependent on your age and now your gender and health history. So gender, females, we live longer, we need care longer statistically, and so females cost more than men. In life insurance, men have always been charged more because they statistically die earlier than females. So the insurance companies kind of caught up on the charging more for females for long-term care. Your health history is important. You don't have to have be in perfect health, but just in generally good health. If you've been diagnosed already with a chronic illness like Parkinson's or Alzheimer's, even if you don't need any care, then, or MS, or if you need any help with your activities of daily living, then you wouldn't be able to get a policy. You get a discount if you're married, but also if you're in a committed relationship, you can get a discount with many policies. A committed relationship means you've been living together for at least 3 years and you share expenses. And the premiums depend on the type of plan, the traditional plan or the linked benefit plan, and the amount of coverage that you choose. And here's a question about family medical history. So for many, many years, insurance companies could not ask about family history. That was a law, and that law ended several years ago. So for the first time, I think it was just last year, one company has started to ask if there's any dementia in the family for immediate family members. If you've had 2 people diagnosed, immediate family members, parents or siblings, then they do not want you to apply with them. If you've had 1 person diagnosed, then you are limited to the amount of coverage. So this is only one company. So I suspect because cognitive problems, dementia, for example, the number 1 claim, or half the claims, I should say, are cognitive problems. So if one company is starting to look at this, probably other companies are looking to that. So my thought about this is that maybe people should buy it or look into it anyway earlier than 50s, because if their parents are diagnosed with dementia, for example, then they may have limited number of options to choose from the insurance companies. Oops. I don't know how that happened. Okay, let me go back. All right, so this is how the insurance works. You create coverage for yourself by choosing from these options. So the first thing you pick from is called an elimination period. It's like a deductible period or a waiting period. It's the number of days that you will pay for your care or handle your care before you can use the benefits. So for example, 90 days is a common elimination period that people choose, but some companies offer a 30-day elimination period, 60-day, or even a longer 180-day or 365-day waiting period. Your premium is lower the longer you wait to receive your benefits. The monthly benefit that you can purchase is between $1,500 a month to $12,000 a month. So that's $50 a day to $400 a day. So for example, someone might pick $6,000. That's actually the most, that's the average that people purchase. The benefit period that you also choose can be from 2 years to 10 years, and one company has lifetime coverage. And the benefit period means that this is the period of time that monthly benefit will pay out if you use the entire monthly benefit. So if you use less than $6,000 in this example, let's say you use $3,000, then your policy would last 8 years, pay out for 8 years. The total amount of coverage in this example is $288,000. You take $6,000 a month times 12 times 4 years, and you get $288,000. So that's the amount that the insurance company is basically on the hook for to pay out to you if you should need long-term care. You can only use a maximum of $6,000 a month, though. You can add inflation on there too, and that would increase the $6,000, that monthly amount, and the total coverage every year that would increase to keep in step with inflation. The difference between the traditional policy and the linked benefit plan is a linked benefit plan has a death benefit. And so if you just die, then money comes back to your estate or beneficiary. And if you use some benefits, but not a lot, then still there's potential for some of the death benefit to come back to the estate or beneficiary.
Mm.
It's stuck. Hmm.
Are you using a mouse, Denise, or are you using the arrow buttons?
Here we go. I
There you
just,
go.
yeah, I just clicked around and it
There you
undid
go.
it. Okay. Do you have any questions that we should interject or just wait?
I think we need to wait because there's so many and they're very good questions, but they're complicated. So I think it would be actually a benefit to everyone if we go through the slides,
Okay.
hear your information, and then one by one, we're going to go through these questions. There are a lot of them. And I think the questions are going to help everybody learn more. They're in-depth questions.
Okay. So the reason that long-term care is important for many people is because the cost of care is quite high. And so long-term care insurance can help take some of that risk off the table and help, supplement some of their own money. So currently in the area that we live in, the home care agencies are $39 to $45 an hour. So if you need a caregiver for 10 hours, that's almost $400 an hour, a day, which would be $12,000 a month. You can hire caregivers privately. Insurance policies do reimburse for private caregivers. You don't have to go through a home care agency. And assisted living and memory care can be $6,000 or more a month. Skilled nursing facilities, $9,000 or more. And adult daycare centers, $70 to $150 a day. So if you add that up and over a year's worth of expenses, it can be extremely, extremely, devastating for some people. So there are some tax advantages for some people to buy long-term care insurance. And when HIPAA was passed and they created these minimum standards, they said, okay, when policies meet these minimum standards, the premium qualifies for a tax deduction. Doesn't mean you qualify, but the premium qualifies, and it's called a tax qualified policy. Now, you probably heard that term, and that's what it means. But whether you can deduct your premium or not is another thing. So if you're an individual, you have to have enough unreimbursed medical expenses to over 7.5% of your adjusted gross income to include your long-term care premium. And the amount you can deduct is based on your age. So for example, in 2022, if you're 61 to 70, you can deduct up to $4,510 of your premium. If your premium is $3,000, then you can deduct $3,000. But you have to itemize your unreimbursed medical expenses. Self-employed people can also deduct their long-term care premium, and they also deduct it based on their age. So again, if they're 61 to 70, they can deduct up to that $4,510. And corporations often buy policies for their executives. They find it a very valuable benefit and hopefully retain their employees. So corporations, C Corps, can deduct 100% of the premium, and they don't have to offer it to everybody. They can offer it just to some select executives. So that's an advantage for them, for sure. I know, Paula, you want to speak to this type of information.
Most people now use the internet for finding resources. And I just find that it's very problematic and that no one should do any of this alone. I know in the caregiver group on Monday, all the members are really helpful about sharing tips and resources and kind of giving each other red flag notices about what to be careful of. So when I Google long-term care insurance, I become very confused when I start looking at New York Life, AARP. Oh, I become confused about if they're the broker, are they offering me the long-term care insurance, or have they have a contract with an insurance broker, and it's really that individual who's navigating, piloting this for me. So I was wondering if you could help us, Denise, understand truly the way into assessing these plans, because is it through AARP or New York Life or Merrill or all these groups who promote it? Who are we really talking to online when we start to give out our personal information too? That's a big concern.
Yes, of course, you have to be careful what you give out online. AARP has an agreement with, different insurance companies at different times. And then if someone calls into AARP, then AARP sends their information to a local agent that has gone through some training with AARP and the insurance company they're working with. So it seems to be a safe avenue, but of course you want to be careful what you give out right, initially. And other, banks and financial groups, they usually have a contract with one company. And so they offer one company to their customers. And so it's limited in that way too. It's usually better to understand what is available out there for you based on your age and your health history, and to see which company would be, give you the best offer, I would say.
Okay. All right. Thank you for that. Okay.
And some people, depending on their health, I've had this happen a few times. Some people have such a health history, problematic health history, that there's only one company they can consider.
Okay. And do most brokers represent different companies, have affiliations with multiple companies?
Yes. So brokers would be, yes. So we as brokers, we work with several companies, and we're not tied to any one company. So we like to do our due diligence, and when we compare companies for someone, hopefully we explain it simply enough so that it's very, very clear which one is probably the most competitive for you.
Okay. All right. So let's keep moving through, because I know we have a lot of questions.
And here's the American Association for Long-Term Care, that group that you mentioned, or that we were talking about. So
Okay.
they list experienced agents that are really, focused on long-term care planning.
Okay. All right. That's good to know. Okay.
All right. So, and this is our last, topic, so we can get into some questions. But many of you might have heard that there are several states considering a payroll tax for long-term care. And one state of Washington, already passed a payroll tax last year. It was supposed to start in January of this year, but it's been postponed because they need to go back to the drawing board and tweak it a little bit. But California is probably the next one that's going to be offering a payroll tax or passing a payroll tax. So a payroll tax is considered a social insurance, like Social Security and Medicare. So just like people working, anytime you're making an income, you're taxed on Social Security. And so it looks like we're also going to be taxed for long-term care. So we don't know what California is going to end up with, but they are looking at what Washington did. So I'll tell you what Washington did. They passed the tax of 0.58% of income, which means that if you made $100,000, if you make $100,000, you're taxed $580 on each $100,000. It's only taxed on W-2 earners right now. So that's one of the things they might be tweaking. They might be also taxing self-employed people that get 1099s. For that tax, there is a modest benefit that you could collect later on if you need long-term care. It is $100 a day for a year. So that's $36,500 that you could collect at some point if you need long-term care for this tax. And they do expect to increase that with inflation. One of the other things they might tweak is you have to live in Washington in order to collect the benefit. So if you start being taxed at you're 25, and you need care when you're 80, you might not be in Washington and may not be eligible for the benefit. So they're thinking about whether it should be portable or not. One of the things they did say was that if people have a long-term care policy in place, and for Washington, it was you had to have it in place by November 1st of last year, then you could apply and be exempt from the tax. So everybody scrambled to get long-term care insurance in, July, August, September, October, so much that the insurance companies were overloaded and they had to stop selling long-term care insurance in Washington. But anyway, so that's how that worked in Washington. In California, it may work the same way. There's meetings, there's a task force that was created. There's meetings almost every month. There's a link that you can, at the end, that you can go on to see when the meetings are. You can go to the meetings, they're public, or you can read the transcript after. They are thinking possibly a flat tax like Washington. Although I'll say the critics think that the Washington plan as is not sustainable, so they may have to increase the tax. So California is thinking possibly a flat tax or a progressive tax. And the benefit would still be modest, like similar to what Washington's offering. Maybe it's going to be 2 years, maybe it's $200 a day. But the big concern with the states is that as we get older, baby boomers getting older, and we're living longer, the states just can't afford people to go on Medi-Cal in California, Medicaid. So they have to come up with alternatives and also make people aware that they must plan for themselves and take this proactive, measure of taking it into your own hands, because even if you do have the money available from this fund, it's not going to be a lot, it's going to be modest. So that's kind of the message from the government. People want the government to provide for long-term care, and they do under Medi-Cal, right? But you have to spend down your assets and income. So the message is basically that there isn't going to be any sustainable policy or plan from the government other than this kind of, modest coverage.
Okay.
And I think when it's passed, oh, by the way, and so the feasibility report from California is due on December 15th. So by the end of the year, they're going to come up with recommendations, give it to the governor and legislature, which may make changes, and then it probably will pass and become law next year. And the tax is expected to start January of 2024. And since it is going to be affecting employees and self-employed people, employers probably will start offering long-term care insurance to their employees, so they have an option to opt out of the tax if they want to. And so that will help people also get more of some more options in their favor. But even if you're offered a group plan, I would say, or a discounted plan, it's always good to compare and do your own due diligence and make sure what you're purchasing is the right thing for you.
Okay. Denise, I'm going to suggest you have a glass of water.
Okay. How can you hear?
I'll talk for a moment because I did just see one question, and I think it's a theme for people who cannot afford long-term care insurance. So it popped up and it said, if you cannot afford long-term care insurance, quote, are you sunk? Now, most people, I would have to say at this point who I've met, do not have long-term care insurance.
Mm-hmm.
And no, you're not sunk. There are many ways to get help, and it just depends ultimately on your health. and what your needs are, and if you have family and people to take care of you or not.
Mhm.
And there's so many factors. So when I say don't go it alone, I really mean talk to your family, talk to your doctors, find an elder care consult like me. There are people to help you look ahead and plan. But for some people, long-term care insurance, the way it is right now, right, it's not affordable for you. And there are many other avenues and resources to try and get help. And so on our resource slide here, the very first resource I put down, the New York Times on Tuesday runs a science section, and in that section, there are always articles under the column, The New Old Age. And the one yesterday was about a program called PACE, which is for low-income older adults who have chronic health care conditions, and how PACE can help them. And it's part of a Medi-Cal program. It's usually affiliated with Medi-Cal, and it's by state, and it's by certain types of services. And so I suggest everybody start reading every Tuesday, the science section of the New York Times, The New Old Age, because it has the most compelling, up-to-date articles on so many things regarding our current aging situation and our future. And then these other two postings today, tell us about those, Department of Insurance and California Insurance Task Force.
The Department of Insurance has a great website called Are You Ready? And it's been around for a long time, but it has a lot of information for you. I suggest looking at that. And the California Insurance Task Force is about this payroll tax. So this link will take you to their to links where all their meetings are, the schedule of meetings, and also prior meetings they could read the transcripts from and just see what's going on with it.
Okay, so I'm going to suggest we take a deep breath, everybody, because this is very detailed information. And I have to appreciate you, Denise, for making your career around trying to help us navigate these complicated scenarios and finances. This is the tough work of aging and trying to figure out what works best for oneself or a family member. And we do need experts in this field. So let's start looking at the chat line. And can
I give
Sure.
one example though?
Oh, sure.
Thinking about the woman or the person who was asking about she can't afford long-term care insurance, and maybe she can't. But I have, just to give you an example of someone who doesn't have a lot of money, and her strategy or her game plan is her family's going to take care of her, and her family's totally on board to taking care of her. So that's the plan. But what she wanted was to be able to have money to hire caregivers to give family members some time off. So she did buy a very modest policy. I think it was about $109,000 of coverage that she could use over many, many years. And she could just pull out what she needs to hire caregivers for a few hours a week to give her daughter some time off. So that's like her strategy. And she and the family were very, very comfortable with that and felt very good about that. And they also planned never to put the mother on Medi-Cal. So that was part of their, own personal choices. So there's ways to plan. It's just a matter, I think, talking and seeing what can be done.
Okay. All right, so I'm pulling up the chat line, and I don't know, Denise, if you want to pull it up too on your screen, because I'm going all the way back to these questions. There are a lot of them, and I'm just going to go down and see where we can start. And everybody, you're welcome to stay on, and we're going to get to your questions. It says, okay, from Margaret, if you are living in a retirement home where there's assisted living, do you also need long-term care insurance, and what does it cost at the age of 88?
Oh, so someone's 88, and I'm sorry, I couldn't see those questions, but so someone's 88 and thinking she'd like to buy long-term care insurance.
Yes.
So there is an age limit of when insurance companies will pay or approve you for a policy, and most of them stop at 79. You could actually buy it at 80, like the day before you're 80. So base it on 79. We have a couple of other plans that can be purchased from 80 to 87, nothing after 87. But I will say that there's not a lot of leverage. So when someone gets older, and of course you have to be generally good health in order to qualify. So if you need assisted living facility care now, then you wouldn't qualify to be able to buy a policy anyway. And plus you're beyond the age that companies would accept.
I want to make a few suggestions based on these questions because I'm trying to answer several of them with a few thoughts.
Okay.
So whether it's home care, assisted memory care, adult day health care, you have to, in your area, do some research and ask around and ask all of these different providers if they do accept long-term care insurance, if they accept veterans benefits. In some cases, adult day health does accept Medi-Cal. So we're not going to have a pat answer for all of your very specific questions. Part of it is going to involve some of you doing research. So here's a question from Catherine. Are people with Parkinson's disease ruled out of long-term care coverage?
Yes, unfortunately, if someone's been diagnosed with Parkinson's, even if they don't need any assistance right now.
Okay.
So the best, definitely talk to your financial advisor and talk about this situation, because at some point, if you do need care, then you have to decide where's the money going to come from? Which asset you're going to use first or second or third? How are you going to manage it? Will you rely on family? Those questions.
Okay, there's from Mark, he's asking about his mother who has 2 types of coverage right now, but she's diagnosed. My mother has long-term care insurance, 2 kinds, one from CalPERS, one from Transamerica. And he's going into deep details about how much each of them cost. But basically the question is, I think she's been diagnosed with a progressive disease. Can she change and start a new policy at this age, or should they just stick with the one they have?
You really need to keep with what you have, because if your mother already has some, an illness that she's dealing with, she would not be able to get new coverage. And the coverage that she had now, whenever she bought it, is going to be so much less expensive than if she could buy a new policy. So it is very important to keep what she has. And typically you can use those policies together. So it's good to look at those policies and know what the elimination period is on it, what the daily or monthly benefit is, what the benefit period is, if there's inflation, and call CalPERS and Transamerica to make sure that you have updated information on it.
Okay, this one comes from a 68 and a 70-year-old participants. They don't have long-term care insurance yet. When we looked into it this year, we were told that we were too late. Can you comment, please, and describe the cost thresholds for the different plans open to our age group, 68 to 70?
So I wonder what they mean by too late.
I think they meant age.
So 68 and 70 is not too old. All the companies out there would insure someone age 68 and 70. So that's not an issue at all. The health history could be an issue. So I would suggest you talk with, sounds like you talked with an agent, but talk to another agent and a broker, someone who works with a lot of companies. So as brokers, what we do is we talk with the underwriters of all the insurance companies. So if I have someone who, whatever their health history is, if it's, very simple, then I pretty much know. But if it's complicated, I'll call the underwriter and talk with them and see how they would look at them, if they would approve them. So we know what companies you could look at based on your health history. But age 68 and 70 is not an issue. You would have the same choices as someone who's 40 and 50. The cost, of course, is based on age, so it's going to be more than that.
So here's a question about continuing care communities, what's your experience with continuing care retirement communities and long-term care policy providers? Do they work together to ensure the benefits of a long-term care policy, that they're maximized? So that's really an interesting question, because it's making an assumption that the business office in the continuing care retirement community, that individual person or staff member is somehow going to be talking to the membership team of the long-term care policy holder, and somehow those two people are going to have a conversation about making sure the benefits are maximized.
Sometimes that works out.
Okay.
Sometimes. It depends on the CCRC.
Right. I think it also depends on the advocacy of the family or the policyholders. So if somebody's in a continuing care retirement community, maybe it's a couple and one is confused and one is not, the person who's managing the finances, whether it's family member or a durable power of attorney, they do really need to be an advocate for the person to understand how all of this works together. Definitely.
And if your agent's around, that's, a go-to person too. And sometimes agents retire or pass away too. But yeah, I've had several of my clients who have moved into CCRCs and later needed care, and their policy, so they later needed, one person needed caregivers to come into her unit. Her policy paid for those caregivers because the CCRC would pay for a few hours, but not all the hours that she needed. She eventually needed to go to the skilled nursing facility wing, and she had her room and board charge there. And that room and board charge was paid by her long-term care insurance policy.
Right. This is why, again, it's so important to proactively plan when we're looking ahead. And, I'm hoping that a lot of our systems and senior care services change in time to meet the needs of a growing population. But given what we have right now, there are, and I will have to say from doing this for 40 years, there's so many disconnects between what people really need, what we can afford, and what is available. Because, for instance, right now, even for the low-income senior housing in our area, there's 3 to 5 years wait lists. Wow. So that makes it difficult. And then people low income who can't afford long-term care relocate, and that's a reality. That's reality. Medi-Cal is not necessarily an answer to any of this. A lot of it is advocacy voting and becoming involved with your local representatives as to what changes need to be made. I think somebody had asked for the referral to the American Association to find long-term care agents. So it was posted up here in the chat line. It's the www.aaltci.org. And we were recording the chat line. And so what I do is I will send out the resources posted to everybody. As long as we have your email through your registration, you'll be getting a list of resources.
I can give you their, I'll find their phone number for you, Paula, and so I can give it to you.
Okay.
I did want to just talk quickly about something you mentioned about making sure that the assisted living facility or nursing home takes your long-term care insurance policy. And it's kind of the other way around. The long-term care insurance. So I think what you're thinking is they might not process or help you with your claim.
But
long-term care insurance would cover, you have to look at your own contract, but generally long-term care insurance covers licensed facilities, assisted living, nursing home care. But some home care agencies, some facilities will send the, invoices to the insurance company and help you with the claim and send the invoices in regularly so that you get reimbursed regularly, and some will not. But it doesn't mean you can't have someone send them in for you on your behalf.
Okay. Somebody's asked a question, Nadine, of how to find the best long-term care facility in the Bay Area that accepts Medicaid if you need it. And I just want to be clear about assisted memory board and care. They do not accept Medi-Cal. So this is where people need to understand the difference between what's considered skilled care, hospital care, your doctor's care, inpatient, outpatient medical care, and nursing home care you are referred to, you're under a doctor's care, that's paid for by Medicare and Medicaid, which are health insurance. Health insurance, Medicare, Medicaid do not pay for a long-term care stay in assisted memory care boarding care facilities, because those are not regulated by health insurance. They're not under the feds, they're under the state, under Department of Social Services, and they're a separate business entity and very different. So I think a lot of people assume there's some sort of health insurance policy that pays for long-term care, home care, residential stay, but there isn't. And if someone wants to talk to me about that, you can call me privately. I'd be happy to do that. Okay. So you have a question. How much more expensive are linked benefit policies than traditional if they promise no rate increases?
Yes, so this is an astute question because when you have the opportunity to get money back and the rates are guaranteed, it's going to be more expensive. So generally, traditional policies, it's going to depend, the difference is going to depend, of course, on your age. And so there's no, linear equation there. But traditional policies, typically, I'll just tell you, if you pay a certain premium every year, let's say you're 60, you pay to 85, and you've paid X amount of dollars for this traditional policy. By the time you're 85, this is a very general example, you would have paid the same amount as you would have with the linked benefit plan, but you paid more upfront with the linked benefit plan. So there's that break-even point, and it's just good to look, with your own individual case to get some information on it so you can compare yourself with real numbers.
Okay. Can the discount on a committed policy apply between a parent and child who are living together and sharing expenses? Parent and child.
I have not had that for so long. And we used to have family member discounts, roommate discounts, things like that. And I just have not had that come up. So I don't think so, but if you would like to call me, I can check it out for you.
Okay. Now somebody does ask, would Medi-Cal planning work together somehow with long-term care insurance? So now the question is, can you have Medi-Cal? And then they do ask when you apply for Medi-Cal if you have any other kinds of insurance. And then if you can't afford long-term care insurance, then they question, I think, where that money comes from. Because when you apply for Medi-Cal, you have to have a very limited income.
Right. You can't get long-term care insurance if you're on Medi-Cal. If you have a policy already and go on Medi-Cal, Medi-Cal would love you to keep your policy in case that you need it later on.
Okay. Victor asks, is the elimination period per occurrence? I'm not sure what he means by occurrence.
Oh, probably like Medicare, where you have benefit periods, you start over. So no, the elimination period is typically a one-time event. So if you need care, collect your benefit, or need care, you satisfy the elimination period and you collect benefits, then, and you recover, let's say, and need care later on, then you do not have to satisfy the elimination period again. Of course, we always want to be sure we look at the contract to make sure that's how it works, but that's generally how the policies work. And I've had that happen with several people who have needed care more than once. I think we're going to start seeing that more and more as we live longer.
Here's a great question that may apply to many people. Does a previous hip surgery impact expense of long-term care insurance?
It doesn't. You mean is it going to affect the premium?
Right. If you've had, they asked your medical history, and if you've had hip surgery replacement, can you still have long-term care insurance?
Yeah, it doesn't
Okay.
affect the premium because they do need you to recover and a certain period of stability before you can apply. So as long as there's no other health issues that are going on, if that's like the only one, then it wouldn't affect the premium as long as you apply when the company is ready for you to apply. Of course, they want you to be, the issue to be resolved and you to be functioning fine and a period of time to have passed, so like 6 months or so, to make sure that there's no other future surgery that you need for it.
Okay, I'm trying to find the questions that are specific to long-term care and not other types of insurance or other kinds of issues. I have CalPERS long-term care payment. It goes up by huge percentage every year. Is there any protection from this problem?
No, CalPERS, I know they're having some significant rate increases now. There's no cap on the amount of rate increases that they can, pose. It was very publicized that, when they started selling long-term care, they invested the money a little bit too risky, and so they lost a lot of the money, their reserves to pay claims, and so they're catching up now, and they have to have these rate increases to build up the reserves. But yeah, to answer the question, what people do is if they can't afford the rate increase, they reduce their coverage a bit so that they can still have some meaningful coverage with a premium that they can afford.
Okay. Catherine asks, can you speak a bit about life insurance policies that have a long-term care rider?
So the linked benefit plans, they're linking two benefits together, and one is a life insurance policy with long-term care, and another type of linked benefit is an annuity with long-term care. The most leverage that you can get of the two is the life insurance with long-term care. In other words, you get more long-term care benefit with the life insurance with long-term care than the annuity with long-term care. So the way it works is that you purchase, you pay a premium for this policy, or you apply and you are approved and you buy the policy, you pay the premium. Then if you should need long-term care at some point, or let me just say, if you die at some point, the death benefit comes back to your beneficiary or estate. But if you need long-term care first, then you are using the long-term care part of the policy. But when you use any benefits for long-term care, you are reducing the death benefit. So $1 used for long-term care reduces the death benefit by $1. So at some point you might use up all the death benefit, and then if you did pass away, then there wouldn't be any more death benefit. Some policies do provide a small amount of death benefit, even if you use it all up. But the concept is, it's a life insurance policy. If you die, the death benefit comes back to the state. If not, you have created much more money for long-term care. If you need it for long-term care, you would be drawing down the death benefit amount first.
Okay, thank you. All right, well, I want to just tell everybody, thank you for all these questions. What we do is we'll post the PowerPoint on our website, and we've recorded in the chat line all the questions, and those we did not get to, Denise and I will look at, and if we do have answers for you, what I'll do is we'll write those out, and then I'll send a thank you and a letter, possibly a survey to everybody, and then give you talking points from the chat line. But several of these questions actually are good thoughts, but they're not about long-term care insurance. They're about many other interesting things: medical tourism, life insurance, death policy benefits. And so I was just trying to find the questions that our speaker, who is an expert in long-term care, that relate to our topic today. So there is a question about if your long-term care policy stops operating and a new company that services it increases premiums and reduces benefit amount, what do you do? Long-term care policy stops operating and a new company takes over.
Right. So And that's happened a few times. Travelers, for example, sold long-term care insurance and they stopped selling it, and they sold their policies to MetLife to service, and then Genworth took over those policies. So the new company that's servicing them, they still have to pay your benefits according to your policy, your contract. If they need to raise rates, it's based on raising rates based on how much they need to collect or to keep in reserve to pay current and future claims. So it's perfectly fine for another company to administer your original policy, because they cannot change your policy though.
All right, well, Denise, thank you so much for today and for donating your time to us today. Everyone, thank you for coming on today's town hall. You're welcome to contact me at pwolfson@avenidas.org, and I'll be in touch with you via email from the registration list. So thanks, everybody. Thank you, Tracy.
Thank you, Paula. Thank you, Tracy. Thanks everyone for coming.
All right.